Okay, so basically ensuring the survival of the species, obviously this is the job of the reproductive system. Now, the reproductive system does interact with other body systems, but the reproductive structures are not essential for life. Now, for example, I'm just going to give you my opinion. Um, you know, Usually we recommend an animal be spayed and neutered at 6 months of age. So, we're taking away their reproductive hormones when they're spayed and neutered. Now, if you remember, other sex hormones are produced by the adrenal gland. So it's not like we're taking away all sex hormones, because part of the sex hormones deal with their muscle development, bone development. And one thing that is kind of a point of there's research is there a benefit to late spaying and neutering, especially in the large to extra large breeds? So, for example, my boxers, um, my goal was to have them neutered around 2 years old. Part of that is to allow for muscle and bone development. There's some theory of early spaying and neutering, somewhere between 4 and 6 months of age, and the lack of sex hormones not getting the equal muscle to bone development ratio. So, and then sometimes those dogs could potentially have orthopedic problems, shoulder problems, OCD, cruciate ligaments, hip issues. Um, Now, the class just radiographed AJ for radiology, and one hip does look like it's slightly out, where he could potentially have hip dysplasia. But the doctor I was talking with is like, well, he's only 9 months old. He's still growing. And the fact that he's intact, he's still going to build muscle. So, he's not showing any signs. No, obviously he runs around like a maniac. So there's no problems. But there is a theory that maybe the late spaying and neutering and allowing some of that, you know, and Brooklyn, that's kind of the issue, is that you can spay and neuter them that young. The issue in the shelter is they want to get them adopted out as soon as possible. And most shelters will not adopt out if they are intact. So they will, and you can do that. You can do the early spaying and neutering. It's not going to there's just a theory of this muscle to bone development, but the advantages of spaying and neutering them kind of outweigh that theory. But again, me as an individual owner, I have the freedom to decide when do I want to have my dog neutered. Now, I do recommend neutering before age of 2, because the longer that they are intact, whether female or male, you have a higher likelihood of reproductive cancers. In the female, you can get ovarian, uterine, mammary cancer is a big one. And in the male, we worry about prostate cancer and testicular cancer. They also have a higher likelihood of hernias, perineal hernias. So I've always told, I neutered Bo when he was 18 months old, and AJ will probably be somewhere between 18 months to 2 years, because AJ is very lanky and tall. And so I kind of wanted to make sure his muscle to bone development, that's just my opinion. Again, you want to make sure they're spayed and neutered. And the worry is the longer you let, especially shelters, if you have them intact and you want to get them adopted out, you really want to control that, because if someone adopts them, they can say, oh, I'm going to spay and neuter them. And then if they don't, potentially unwanted breedings and such. So that's, that can be a whole topic in an entire class. But, I will tell you, most clinics, 6 months of age, and in most dogs, that's adequate. The only time, like I said, in the large to extra large breeds is maybe, a year old or a year and a half, seeing if you can delay it. But in a shelter, you don't have a choice. They have the authority. They own the animals. They make the decision. So now, obviously, it requires a second animal, obviously a male and a female. We know how reproduction works. But there is, places that do, especially in large animal, that do artificial insemination. They do semen collection and they artificially inseminate. When you're dealing with high-end horses, you know, we're talking about like race horses, performance horses, or if we're talking about high-end, you know, beef cattle, dairy cattle operations, you know, you also worry about damage or injury. You know, it's very dangerous when a male mounts a female horse, and you know, if you can do that in a controlled environment, sometimes it's easier to collect the sperm and artificially inseminate the female. There's a, you know, more chance of success, less chance of injury. So I will say, there are doctors, I will, on a side note, also mention, and this is kind of a job opportunity. There, you know, there are doctors that are called theriogenologists. So it's a veterinarian that after they graduated, they specialized in reproduction, and that's their primary job. We had one that worked at BCA, and she would work with, you know, dog breeders, but also with cattle and horses, and, you know, dealt with, you know, disorders of the reproductive system, also problems with breeding, but basic semen collection. And there are technicians that can be employed. You can be trained to collect the sperm and do the artificial insemination. So it is a potential, you know, field for people to go into. It can be a pretty big business. So I will just mention, I like to give you guys all this information, you know, because again, we think of, you know, just let them out in the pasture and go ahead and, you know, she's in heat and here's the male. But a lot of times in high-end operations, they control that and do it via artificial insemination. So when we talk about fertilization, the actual sperm has to penetrate the ovum, and it just takes one sperm to penetrate one egg. I'm going to skip over meiosis, chromosomes, just time-wise, so we can get to the basic anatomy. I want to mention about cell division. So mitosis is when the chromosome will produce a duplicate of itself. And so when we talk about the mitosis, we talk about the dividing, and this is when the cell gets fertilized and it's going to start to divide. So I'm going to skip over this, and let me just we're going to start with the male. The two pictures that are going to be on this final is going to be the male reproductive tract, this picture, and then the female reproductive tract. So this is the picture that's going to be on the final. So let's look at this anatomy. When we talk about the male reproductive system, the testes or the testicles are the male gonad. Now, a gonad is a reproductive organ. So the male gonad is the testicles, the female gonad is the ovary. Now, in the male, the testicles are actually housed outside the body. Okay, so when you have an intact male, dog or cat or whatever, and you'll see the scrotum, and there should be two testes or two testicles descended. And this is where the male cells are developed. So this is where spermatogenesis takes place. So there are spermatocytes in here that are going to mature into a mature spermatozoa. And again, they are housed. So in this picture, you've got kind of this white line. This is the scrotum, and inside are the testicles. Now, it kind of looks odd in this picture, but there is going to be a spermatic cord, and then there is a tube that is called the vas deferens. And the vas deferens comes from the testicle, and it brings the sperm, and it joins up here at the neck of the bladder. So if you follow me here, you know, here's where urine is produced. And if you remember, urine exits the bladder via the urethra. Well, the vas deferens connects to the neck of the urethra. So when a male goes to breed and when they go to ejaculate, basically there is a muscle that will close off the urethra part of the bladder. So what comes out should just be semen, which is sperm and the fluid. You don't want to get urine mixing, because again, they share the same tube that was on your, urinary test. Is the urethra in the male has reproductive and urinary function. But again, when they're breeding, that muscle is going to close off at the bladder, so you should only get um, semen in a normal animal. Now, what I will show you here, wrapped around the urethra, right here at the neck of the urethra, is their prostate gland. And I'm going to talk about the prostate gland because that produces the seminal fluid. Because semen is seminal fluid and sperm. So the sperm are produced in the testicles, and I'll talk about where the seminal fluid is. Now, when the urethra goes through the middle of the penile tissue here, and it exits right at the opening, and now this prepuce is the covering you see. If you look at a male dog, the prepuce is the skin covering. Sometimes you'll see, sometimes when they urinate, and you'll see where the penis will sometimes extrude. And sometimes dogs, especially male dogs, sometimes they're very happy and they're jumping on you and they get, and you look down and you're like, okay, the penis can extrude and come out of the prepuce, but it should retract in because the penile tissue is a mucous membrane. And if it stays out, it can get dry and get injured. So, it does come out periodically, but it should retract, and that prepuce is the covering that will protect that. Now, in this picture, there's other things. So we've got the rectum, which attaches to the colon, and then we have a kidney and the ureter here. Don't get confused. Again, that's the ureter. This is the urethra. Now, what's interesting is since the prostate lays right under the rectum, so when we do a prostate exam on a male, usually what the doctor will do is a rectal exam, and they go in with a gloved finger and they will feel to see if it's smooth or enlarged. What was interesting, well, jump ahead a minute, but because I'm talking about this picture, I think it's easier to explain. We sometimes, when I did radiation oncology, and we sometimes saw dogs with prostate cancer, and they would have an enlarged prostate. Well, we had a dog that had such an enlarged prostate, and there's lymph nodes above the rectum. The cancer had spread to the lymph nodes. So we were radiating the lymph nodes and the prostate to try and shrink them. But the dog had a very hard time defecating. The dog, when he would defecate, it would come out flat. It's called ribbon-like stool because when they go to squeeze, that prostate can compress the rectum and cause the stool to come out flat. Well, part of my job when I radiated was I had to do a rectal and feel if, did I feel any changes? In this poor dog, I could not even get, normally I could put, you could put the whole finger in the rectum. I could only get the very tip of my finger because it was so swollen from the tumor and the lymph nodes. But that's how we do a prostate exam on a dog is, again, the prostate's here, but you can, and like in a large animal, if they needed to check the prostate, they put on what's called an OB sleeve. It's a big plastic sleeve, and they have to go in usually with like a whole arm. But if they feel the bottom of the rectum, the prostate's right under there, and you can feel if it's enlarged or lumpy or bumpy or things like that. So if we are worried about prostate issues, a rectal exam is going to be one of the first things we do. Now, the other thing that happened in that dog was the dog could not urinate. It would go outside and cry, but it would just go drip, drip, drip. And the bladder was huge. Well, the problem was the tumor was compressing the urethra because the prostate is around the urethra. So what happened is when the prostate swelled, it put pressure on the urethra. So the two things was the dog was, not urinating completely. It was just kind of drip, drip, not a good stream. Sometimes it's like spotty. and the dog was straining to defecate, and the stool was coming out not like normal stool, it was kind of flat. So those are two like kind of red flag clinical signs, and the fact the dog was not neutered. So prostate cancer is kind of high up on that list. So I'm going to talk about some of this anatomy, but we'll come back to this picture. Spermatogenesis, which occurs in the seminiferous tubules, which are inside the testicles, is, a spermatozoa is a mature sperm, but the spermatocytes are going to change. But also the testicles produce the male hormones. And an androgen is a hormone, a sex hormone. Testosterone is the primary male hormone and that is produced in the interstitial cells, which are around. So again, an animal will always have sex hormones, even if they're spayed and neutered, but you take away the majority of their sex hormones. So there isn't a drive to breed. Also, male dogs tend to be a little bit bullheaded and sometimes have behavior issues. And, a lot of times neutering is recommended if they're intact. Male dogs that are intact tend to fight more, roam, can be aggressive. And one of the first recommendations, neuter them. That's, I want to wait till he's 18 months or 2 years. But I said, if he becomes a jerk, he's losing them, because sometimes that testosterone, and that helps curb, and it maybe doesn't fix everything, but I will tell you, neutering a male can curb a lot of this behavior. So that's usually recommended. So what a spermatozoa, there are 3 parts to a sperm. So there's typically a head, a midpiece, and a tail. So 3 parts. Now the head of the sperm is actually the nucleus. That's what carries the genetic material. There's mitochondria in the midpiece, which gives the energy. And the tail, if you remember, we talked about cilia and flagella. Sperm is the only cell in the animal that has a flagella. So it's that one long wave-like projection. Now, because I was talking about jobs that you can get or down the road, well, ClinLab 4, you guys talk about reproductive cytology. Part of if you have somebody that comes in the clinic and their animal is not becoming pregnant, they've tried to breed their dog or they've tried to breed their horse, and they're not becoming pregnant. We've got 2 ends to this equation. Is it a female problem? Is it a male problem? The first thing you have to do in a male is we collect a semen sample. There's lots of things we evaluate, but one thing that you evaluate, are the sperm normal? Is there a normal, kind of looks like a light bulb shape. It's not a perfect circle. It's kind of like wider at the top. Is that normal shape? Sometimes what happens is their tails are coiled instead of long and wave-like. One of the things you also do when you evaluate semen is you put it on a slide immediately and you look for movement, because they have to be linearly modal, or they have to move in a line. Can't talk. If your sperm are going in a circle because the tail is, say the tail is broken or the tail is coiled, they're not going to get to the ovum. So sometimes, you can have a normal female and it can be that there's abnormalities to the sperm. And that happens. We'll also talk about now the semen, the fluid that enriches the sperm can have abnormalities. Say, for example, urine, say that muscle wasn't closing off and urine was mixing with the semen, that can affect the semen. So there's lots of things that we have to analyze, but you have to look at, do you have a normal shape? And again, when we do a semen evaluation, we literally go from collecting the sample to looking at it, because you want to look at live motion. This isn't like you send it to the lab and you do it tomorrow. It's pretty much, usually you're doing it right on site. And you're going to look for motion and movement. Numbers, are they producing enough sperm? Sometimes there's low numbers, and that's the problem. So you got to look at both ends of the equation if we're trying to diagnose a breeding issue. And again, if they have abnormal sperm, they may remove that animal from that breeding program, saying, okay, we're not going to use this male just because maybe there is an issue. But got to look at that. Now, the testicles, interestingly, in utero, when the fetus is developing, they are actually up near the kidneys. So what happens as the fetus begins to grow, they will descend. They'll go from the kidney, which is kind of in the cranial dorsal abdomen, and they're going to move all the way back, and they have to move out of the body down into the scrotum. So they're going to start to move. Now, this line here, if you look where I'm pointing, this is actually the body wall. This is the abdominal wall. There is an opening there called the inguinal ring. So the inguinal ring is right down in kind of like, if you look in their groin area, there's a small opening, and what happens is there is a band of tissue, and it is called the gubernaculum. I think that's such a funny name, but the gubernaculum pulls the testicle down from the kidney, and then it attaches and anchors the testicles inside the scrotum. So there should be, as they descend, there should be two testicles, and they should be anchored inside the scrotum via this tissue called the gubernaculum. Now, this is something that's important to understand. When do testicles descend? Now, I got AJ, he was 6 weeks old. I got Bo when he was 8 weeks old. One of the first things that we do on a puppy that's a male is, and before I even hugged him and been like, you're my puppy, I flipped him over and I grabbed him. My husband's like, what are you doing? And I was like, I want to make sure he has two testicles descended, because sometimes you'll have an animal that's called a cryptorchid. Now, in a cryptorchid animal, sometimes that means you can only find one testicle. Only one testicle has descended. Now, could the animal only have one testicle? Possibly. I never say never to anything, but what's more likely is the other one is retained in the abdomen. The other one didn't descend. Now, we don't typically, if Bo or AJ at 6 or 8 weeks, if they weren't descended, I wouldn't be like, oh my gosh. Usually if they could be a late descender, and usually about by the 3 to 4 months old, they should migrate down. Now, if you have an animal that's between 4 and 6 months old, and there are still only one testicle, or maybe there's no testicles descended, but usually one is descended and maybe one is not, then it's a different type of neuter surgery, because you have to go in and get the other testicle. Sometimes it's right inside the abdomen. Sometimes the doctor can like reach up and feel it just like under the inguinal ring. It's like it didn't quite make it. It's almost there. Sometimes it's up in the abdomen somewhere. It just didn't make it down. So a cryptorchid can have different forms, but the issue is if you only remove the descended testicle and the other testicle remains in the abdomen, it's going to produce hormones. And it can, we had a case where they sent a dog to us that had an abdominal tumor. And we ultrasound the dog, and there was a mass up by the kidney. It was a big tumor by the kidney. And they took a sample and aspirated it. And when it came back from the lab, it came back as testicular tissue. And the owner goes, well, I got this dog from a shelter and they said he was neutered. And we were like, well, and it makes sense that that mass was by the kidney because that's where the testicles develop. It just never moved down. Now, I don't know, could that dog have had 3 testicles? I never say never, but more than likely there may have been some error where only one was removed. I never heard what happened. He was going to contact the shelter and see if there was anything in the records. But the thing is, if you leave behind the other testicle, it's going to continue to produce hormones. Now, I always get this question in class, can that animal breed with a retained testicle? Yes, they can. They are still producing hormones and sperm. The problem is, because the testicles it retained, a lot of times those sperm are going to be abnormal and maybe not viable. It's always a possibility. That's an active testicle and it's actively producing sperm. But the fact that it's retained, most of the time, it's going to be, it would be rare that it would produce normal sperm and we could get reproduction. But I mentioned that, if you guys are in a clinic and you do puppy visits and the owner's like, where's the other testicle? I mean, it's up to the doctor, but a lot of times they're like, well, let's give it a couple months and see, and when it, obviously when it's time to neuter them, you got to make a call. If it's not neutered or if it's not descended, then again, you have to it becomes an abdominal surgery. So, but I'll talk about that a little more. So the scrotum itself is the skin that just houses the testicles, protects the testicles outside the body. Now, the other thing that's important about the testicles is and this kind of goes back to why we don't want to retain testicle. The testicles are outside the body because they need to be cooler than body temperature. And this is why if they have a retained testicle, that testicle is in the body cavity at body temperature. And that's what can damage the sperm. So the sperm need to be cooler. So there is a muscle inside the scrotum. So think of it like anchored to this. The scrotum doesn't move itself. The scrotum is just the sac of skin. But there's a muscle inside called the cremaster muscle. And it comes through the abdomen and it attaches through the inguinal ring, attaches to the scrotum. That muscle can raise the testicles or lower the testicles based on temperature. Now, this is going to sound funny, but like I said, I have 2 male dogs. AJ was just outside in the snow and he's very male, like there, you can see him. But when it's cold outside, a lot of times you'll see their testicles might be really close up to their body because when it's cold, the cremaster muscle will pull the scrotum to keep the testicles warm. Now, if it's hot out, they can be lower. And then you're like, there they are, because the cremaster muscle will lower the scrotum. And again, that's an autonomic body control of that muscle based on the temperature of the testicles. So that muscle raises and lowers the scrotum based on keeping the testicles cool. You need to keep them cooler than body temperature. Now, around the testicles, and there's this kind of net-like structure called the spermatic cords. Now, they're tube-like, and inside these tubes are the blood vessels, the nerves, the lymphatic vessels, and then also inside this spermatic cord is the vas deferens. But basically, this is the link of the blood supply and the lymphatic supply from the body to the testicles. So again, you have to get blood supply to the testicles, lymphatic supply, nerve supply, and basically it also helps form a heat exchange mechanism. This netting here is called the pampiniform plexus. So a plexus is kind of like an arrangement of vessels. So nerves have a plexus, and usually that's like multiple nerves come in one area that kind of looks like a net. This reminds me of a net. But for example, if, mostly we move the scrotum up or down to cool them, but also if the testicles need to be warm, the body can send more blood down through these spermatic cords and warm the testicles, or kind of constrict the blood supply to cool the testicles. So it's a way to relieve the temperature or increase the temperature. But again, it's the blood supply from the body to the testicles. Because again, the testicles are outside the body, but the blood supply is in the body. So we got to get the blood supply, the lymphatic supply, and it's through these spermatic cords. And then I'm going to talk about the vas deferens. Now, when the testicle itself starts to move from the abdomen out through the inguinal ring, okay? The inguinal ring isn't there's an opening there, but there's connective tissue because we don't want like a hole. There's not a hole into the abdomen. So there's layers of connective tissue there. So what happens as the testicle moves through that ring, it's going to be wrapped with connective tissue. And there's a couple different parts. There's what's called the visceral vaginal tunic and the parietal vaginal tunic. Well, if you remember visceral and parietal, visceral is the side that faces the organ, parietal is on the outside. So here you can see the testicle comes down, goes through, and then it gets wrapped around this tunic. And again, even though this is a male, I know it says vaginal tunic, but that's what it is. So you've got the vaginal tunic, and you've got the side that touches the testicle and the side that faces out. I have to show you pictures, and maybe I'll just post a video of a canine neuter. But if you've ever watched a canine neuter, when the doctor first makes the opening and they pop the testicle out through the tissue, it looks like it's white. It has this white fibrous covering, and the doctor will cut it. They pop it open, and there's another covering, and they'll cut that, and then they pop that out, and that's the testicle. So there's a couple layers of tunics that cover and protect the testicle. Now, an orchiectomy is a fancy name for a neuter, a canine castration. Orc is always pertaining to testicle, and ectomy is removal of. So an orchiectomy is a castration. And you got to cut through the tunics to get the testicle. Now, so the vaginal tunic is the first tunic that's cut through. The next tunic is called the tunica albuginea. And this comes from alba, or white. It's a white capsule. So tunica, tunic. And this is basically the covering to the testicle. So the testicle is covered with the tunica albuginea, then it passes through the vaginal tunic. So now there's 2 layers of tunics. It's very fibrous. It also, so it covers the testicle, but then the tunic also goes inside the testicle and creates these septa. So these septa divide the testicle. Now, what you're looking at here is this little bump over here is the epididymis. This is the testicle. These are the septa. And inside you have these tubes. You see these things that look like spaghetti? Sorry, I hope I don't ruin spaghetti for anybody, but if you look at this little tubing and you pull out some of this, this is the seminiferous tubule. And so inside the testicle are all these wound tubes. And again, that's where the semen is produced. So let's look at the tubule. If you pull out the seminiferous tubule, and this is where spermatogenesis takes place, if you cut it in half, so you see we're kind of zooming in on the inside of this tube. Here's the circle. So inside the seminiferous tubules, you have a spermatocyte, which is an immature sperm. It's going to turn into a spermatid and then eventually a mature spermatozoa. It's kind of like you have the egg and then you have a tadpole and you have a frog. You know, so we've got a spermatocyte turns to a spermatid, becomes a spermatozoa. And that all takes place in these tubules. And all these tubules are within the testicle. Now, also inside these tubules are things called Stertoli cells. And a Stertoli cell is basically, so the immune system, they're kind of like trying to hide the spermatids and the spermatozoa because the body might think of them like an invader, like, what are you? You know, and the immune system might attack it. So what a Stertoli cell does is basically protect the developing spermatids from the immune system. Now, what's interesting, when we get into testicular, well, I don't get into testicular cancer, but some men can get what's called Stertoli cell tumors. And it is a cancer of those cells that are within the testicles. Again, so a Stertoli cell tumor is a cancer of the Stertoli cells. But the job of a Stertoli cell is to protect the spermatids so they can turn into mature sperm without getting attacked by the immune system. Okay, so inside here you've got, and then around, if you guys remember, around these tubules are cells called the interstitial cells, and that's what produces testosterone. So testosterone is not produced inside the seminiferous tubules, it's made around the seminiferous tubules. And if there's any questions, just holler. Okay, in this picture, it's showing you the epididymis. So this is during a neuter. Okay, so during a neuter, basically after the two tunics are cut through, the doctor pushes the testicle up and then they can pull the testicle. And what you're looking at on this here, it says averted parietal vaginal tunic. Okay, basically when you cut that tunic, it's like taking your sleeve inside out. They've taken the tunic and they've kind of pulled it off the testicle. Now you just have the testicle showing. And here is the testicle itself. This band of tissue around the testicle is called the epididymis. Now the epididymis is where mature spermatozoa are stored and they can mature. So they begin development in the testicle and then they move into the epididymis and they're kind of stored. Now it's like a flat ribbon. There is a head and a body and a tail. What's interesting, and I don't know if you have any intact mash brain. No, AJ's sleeping. You know, you think of the testicle as being round. Sometimes when he's laying there, you can kind of see a little bump on each of his testicles. That's the head of the epididymis, kind of like pointing out. So you can see where, you know, it kind of wraps around the testicle, and that's where the sperm. So if we look at this picture, so here's the testicle, here's the head of the epididymis. Now this, you've got all this blood supply came from this, again, panpiniform plexus. So this is all the blood supply, the lymphatics. And then within this whole, sometimes it looks like just one kind of chunk of tissue. In that chunk of tissue, blood supply, arterial and venous, lymphatic supply, and then you have the vas deferens, which is right there. Now, here's the body. This is where it goes into the body. Now, during a neuter, the doctor is going to clamp here and here, and they're going to tie a suture to cut off the blood supply, and then they will cut, and then all of that is removed. A little bit of the base of these tissues will go back in the body. But again, you've taken the testicle, you've taken the blood supply, and they do this for each testicle. You do one at a time. So let's talk about the vas deferens, which is, so here's the testicle. Again, this is not the picture that's going to be on the test. The other one is, but I just want to mention it. You've got the testicle, and then you've got this yellow, here's the epididymis. Now, this is where the mature sperm are. Now, when they go to breed, and the male goes to ejaculate, the sperm are going to move from the mature sperm, are going to go from the epididymis through the vas deferens. Now, the vas deferens goes into the body. See this ring here? You have the inguinal ring. Goes in through the vas deferens, and it joins at the neck of the bladder. And then the urethra, it's not in this picture, but the urethra is going down the middle of the penis and then comes out. So the way the sperm get from the epididymis and the testicle is it travels through the vas deferens. The vas deferens takes it up into the abdomen, around to the urethra, and that's where, that's how it travels during breeding. Now, I did tell you guys, oh, I'm going to get into that in just a second, Brooklyn. I'll explain that. It's coming up. So I'm going to talk about these accessory glands, but basically when the vas deferens joins at the neck of the bladder, you see right here, there's a prostate gland, and in this picture is a seminal vesicle. The prostate gland and the seminal vesicles make secretions called semen. So once the sperm, again, the testicles just make sperm. So when the sperm come up here, it has to mix with fluid. Now, the fluid, I'm going to talk about what's the job of semen. But basically, it has to mix with the fluid. So when it leaves after the prostate gland, now you have semen. When you come to the prostate gland, you just have sperm. Mixes with the secretions, and then it becomes semen. So semen, again, is spermatozoa and seminal fluid mixed together. And that's where it comes out. Now, again, the urethra, which I've already covered in urination, in the male has urinary and reproductive. It carries the ejaculate, the semen, to the end of the penis, basically. But again, during ejaculation, during reproduction, the urine flow is blocked off. So you do not get mixing of urine with semen. Again, it should just be semen, or you're going to damage the sperm. Now, there is the part there's the pelvic portion and the penile portion. The pelvic portion is up around the pelvis, and then after it bends around the pelvis, then it becomes basically right here, and it's not in this picture. Here is the rectum, here is the sacrum. See this bone up here? The pelvis is right about here. So, or the pelvis is actually underneath. So the urethra it has to go around the top of the pelvis and come underneath. So that's when we talk about the pelvic portion versus the penile portion, which is here. So this would be the pelvic portion, and then down here would be the penile portion. Now, the accessory glands, what I want you to know, accessory reproductive glands, they are in the pelvic portion. They're around the pelvic portion of the urethra. Now, different species have different combos. A is a stallion, B is a bull, C a boar, D a dog. So a stallion has the seminal vesicles, the bulbourethral gland, and prostate. If you go over here to a dog has an ampullary gland and a prostate gland. So not every species has the same combination of, I just want you to know the prostate is an accessory reproductive gland. That's the only one I'm going to stress. But again, different species have different combinations. So what is the job of the accessory reproductive glands? They produce, and this is important, alkaline fluid. So remember, pH 7.4 is base. So this would be pHs up in the 7.6, 7.8, 8.0, a high pH, which is alkaline. And the reason is the female reproductive tract is acidic. The female reproductive tract does everything it can to try to not get pregnant. So the male reproductive tract is like, okay, what can we do to help you out? We are going to make your fluid very alkaline. So when it hits an acidic environment, it kind of acts as a buffer to help the sperm live. That's what we're trying to do. Now, what is also in this fluid? The fluid is very high in electrolytes, which help balance the cell membranes. High in fructose, which is a sugar. So that's what gives the nutrition, because sperm are alive. And then also prostaglandins. If you remember, prostaglandins are tissue hormones. During breeding, there is inflammation, okay? Again, we're trying to kill the sperm. We don't want to get pregnant. So they're like, okay, well, we're going to give electrolytes to help stabilize the membranes. We're going to make it alkaline so it doesn't, the acidity doesn't kill us off. We're going to give us energy to swim with fructose, and these prostaglandins decrease inflammation. So what you guys need to know is accessory glands like the prostate make the seminal fluid, which is high in electrolytes, fructose, prostaglandins. The seminal vesicles and the prostate glands are the common ones, and this produces the seminal fluid. Now, if you go back to the beginning of the lecture, remember I told you if there's an animal, they're not getting pregnant. We got to figure out why. Well, if we look at a male, not only do we look at, when we look at a semen sample, you look at sperm, number one, normal shape, normal motility, normal numbers. Then you measure the fluid. If you have acidic seminal fluid, the acidic seminal fluid might be killing the sperm, and that's why the animal's not getting pregnant. So you look at the pH, you can measure the sugar levels, you look at the color, it should be very, white. And you guys do this in Clone Lab 4, so I'm just kind of giving you a preview. There's lots of steps to figuring out, is it normal seminal fluid? It has to protect the sperm. This hopefully ensures, adequate breeding. Am I still frozen? Okay, sorry. Okay, now moving down to the penis, which is the breeding part of the organ, which is primarily muscle. We have blood supply, erectile tissue, a lot of sensory nerve endings. Now, right down the middle of the penis is actually the urethra. So when we talk about catheterizing a male dog, which is extremely simple, you kind of pull back the prepuce, we get the penis to come out, and we can pass a catheter in the opening. It goes right down the middle of the penis, and then hopefully should go around the bend into the bladder. So the urethra goes right down the middle. It does have 3 parts. Let me go back to the picture, it's easier. Okay, so you've got the root and the body and the apex. And if you look, there is this muscle right here. It's called the retractor penis muscle. Now, when an animal is retracted, okay, when their penis is inside their body, basically it's an S shape. Now, when it comes to breeding, or sometimes when they urinate, and it does come out, but when they go to breed and they extrude their penis, that muscle right here, which is anchored to the pelvic bone here, when it relaxes, it's going to relax this S shape, and it's going to allow the penis to extrude. So you've got the 3 main parts, the root, the body, and then let me talk, which all I want you to know, it does have an S shape, has erectile tissue to engorge with blood supply, and also that it will straighten out. Now, at the end, the glans is the very tip, the very distal end that we see. It has a lot of sensory nerves. And then the prepuce is the sheath of skin that encloses the penis. So again, when the penis is not erect during normal, everyday, their penis should be inside their prepuce. I want to make a note about this. Sometimes, and it can be rare, sometimes the end of the penis can get irritated and stay out. It's a little bit of a funny story, but we had a little Yorkie, male Yorkie puppy that came in on ER, and the penis was swollen and it was sticking out. It was kind of red and irritated. Obviously, it was drying out. But the owner says that he likes this teddy bear. And the problem is that he humps the teddy bear constantly. So probably what happened is, and some dogs do that. Sometimes they'll find a blanket or something. Sometimes you guys might have dogs in the kennel. They jump on your leg and they, sometimes hump in the air. It just happens. But it caused enough irritation to that penile tissue that what happened is it couldn't go back in the prepuce because it was swollen. What we did is we sedated him pretty heavily, and we cleaned it. Actually, what's interesting is we put sugar on it, table sugar, regular granulated sugar. We mix it with a little bit of saline to make like a sugar paste, and the sugar drew the fluid out of the tissue, so it became less swollen. And then we added some lube, and we could get it back in the prepuce, and then we put a couple little stitches so that the little bit of the tip could come out so he could urinate. But we had to get the penile tissue, and we put him on anti-inflammatories and pain meds to kind of like hopefully reduce the swelling. That's the problem. Now, in that dog scenario, we were like, you probably should neuter him and take away the teddy bear because, you know, we don't want him to do this again. So there are situations where animals could come in where sometimes, again, it does come out. If it stays extruded, which just means it's out too long, again, the penis can dry out and it can become damaged. So we have to be careful. Now, the other thing is the male in the dog, the urethra runs through the os penis. So if you remember, there's a bone right there. It's a floating bone because it's not attached to the skeleton. And an os penis actually has a groove in it, and the urethra can lie right in that bone. Now, this is maybe what Brooklyn was getting to. There's not quite at the very end of the penis, there is something called the bulb of glands. And what this does is when a male dog mounts a female, and what happens after the penis goes inside is this bulb of glands will swell, and it's called the copulatory tie. So what happens is when they're breeding, they're kind of technically tied together. Now, this can last for 5 minutes up to 30 minutes. If that is swollen, the penis can't come out, and it kind of ties it, and it's supposed to ensure breeding. It's supposed to ensure that the male stays in there and they stay intact. And maybe, just maybe, let's see if I can, sorry, hold on. So it's called the canine copulatory tie. And what happens is, it can look various ways. Now you can probably see all these pictures. So you might come outside and, well, why are they standing like this? Well, technically, the male is still attached to the female, and they have to wait for that gland to reduce in size. You don't want to try to pull them apart. You can cause damage to one of them, both of them, if you try to pull them apart. So you generally just have to let them calm down, and it will happen on its own. Had a lady call me in the ER, and she was freaking out. She's like, there's a dog on my dog in the backyard, and I can't get him off. And I was like, stop pulling them. Stop pulling them. I said, unfortunately, and I said, is your dog intact? And she said, yes, I have a female, and I don't know where this male came from, but got in her yard and mounted. And I wanted to say, unfortunately, well, congratulations. I mean, and then by the time she got on the phone with me and went back, the dog was gone. So when it calms down and they can pull apart, then but it's called they're tying up. Or you have the copulatory tie. So you've got where it swells here, and they literally cannot pull apart. So, so here is the bulb of glands right here. So sometimes you find them, I'm trying to find the picture. Here we go. You can find them at various stages. Normally a male mounts from behind on top. And then you can see we're starting to come off the side, and then we're kind of like, so sometimes they look like they're butt to butt, sometimes side to side, but again, it happens during mating. Now, something let me see if I can find a picture. This isn't a great, there we go. Okay, sometimes, and this happens, you guys might be restraining for various things in class. You have the dog rolled over, And sometimes, you know, they're swollen right here. So here's where the testicles, you know, they're swollen right here. So here's where the testicles normally are if this dog's been neutered. And then the os penis runs right here. And this is the prepuce, and there's the penis kind of sticking out. But sometimes a male dog will get a little excited. Just, you know, you're petting them, you're talking to them, and, you know, and sometimes people think it's weird, but you might roll them over and see this swelling. That's just the bulb of glands is swollen. I Before I went to Purdue and I was on the job trained, we had a dog that had trouble urinating, and my boss was like, "Can you go get a urine sample?" So I liked this dog, and I rolled him over, and I was going to get my urinary catheter, and I come back and I see this big swelling, and I'm like, "Oh my gosh." And I go to my boss, I'm like, I know why he can't pee. He's got a big tumor here. He's got this big swelling here, and it's probably pushing on his penis, and he can't pee." And my boss comes back, he's like, "Well, this is a young dog. It's a UTI. I don't know what you're talking about." And when he comes back there and he looks at this, he's like, "Christine, he's just really happy to see you." And I was like, "What are you talking about?" I did not know. You know, here I am on the job trained, and kind of embarrassed because I'm thinking, "Oh, I've solved this dog's problem." And then like 5 minutes later, it's gone. Emily, yes, it can. It's more common when they're intact, but you can see it in neutered males. So you know, I get this question sometimes. One time, some students pulled me in the kennel. They're like, "Miss Landeros, something's wrong with our kennel dog," and they were using him for skills, and they rolled him over, and they're like, "Why is he all swollen here?" And I had to explain, you know, this is what this is. So sometimes you see it, and most of the time, like I said, neutered or unneutered males, but can sometimes happen in neutered males. But that just is where, and that's where you locate it externally, is where you would see that bulb of the glands. Let me get back to, where's our PowerPoint here? Okay. So, and then let me just show you, now it's a little bit different on the equine penis, because the equine penis has a lot more, a larger component of erectile tissue. And then the end kind of has a mushroom shape. So it tends to, and again, it's going to, now in a male horse, they don't have like the same type of, they do have like a little flap there, but it's not like a full prepuce. Their penis will extend kind of straight down and then retract. And then at the end, they have at the tip, they have right here is number 3. This is where the urethra would come out. They kind of have this fossa. Remember, like a fossa is a depression. This is called the fossa gland or fossa glandis. Now, one thing I will tell you, if you deal with horses, a lot of times, you know, a horse is out in a dusty pasture, and, you know, sometimes the penis will extend, they'll urinate. Sometimes it hangs out for a little bit, but as they pull it back or as it retracts, you know, it's been exposed to dust and debris. And a lot of times in this fossa, they can get a lot of discharge and dirt and dust buildup. And a lot of times this needs to be cleaned, and it's called cleaning the sheath. So people that own male horses, periodically, you get a glove, you get some gauze, and you may like flush up solution in here. Sometimes they can get a little thing on the end that forms, it's kind of called a bean, because it just gets a buildup of discharge. Because again, it's a lot of tissue that extends, and then when it retracts, it picks up a lot of debris with it, and that builds up with normal like secretions and, you know, and again, so a lot of times a male, when they say, so where I would say in a male dog, you're talking about the prepuce. In the horse, that skin kind of retracts up in the sheath, which is like a covering, but a lot of times has to be cleaned. Now, what happens here is you have the sigmoid flexure. So I was already kind of talking about this. when the penis is retracted, it naturally has an S shape. Now that when it has to extrude for breeding, basically that muscle is going to relax and allow the penis to come out. And then when it goes back to its retraction, it goes back to its normal S shape. And then basically the male reproductive functioning, obviously the erection is, when it prepares, but ejaculation is a mixture of the sperm and the semen to carry it to the female. And I will start with the female tomorrow. So does anybody have any questions? I know I kind of said a lot, and hopefully some of that makes sense. The male side of things. And tomorrow we'll talk about the female side of things. Okay, well, what I'll do first, I'll get the homework sheet and I will get that posted. Again, that probably will be due on Monday, so I'll get that posted. And I'll also, this late afternoon, evening, work on the schedule for dissection. So I'll hopefully get all of that updated. Do you have any questions? All right, I'll convert the video, post the homework. If you need something, let me know. If not, I will see you tomorrow.